and then another puff.
As much as he can, doesn't have to count to 10.
Yeah, okay.
Otherwise, you can lose him. So,
So this is, you know about it already. This is how. No, I don't want more. So this is how it is used, and this is the best way to describe it to your patients. So, do you have any corticosteroids to give to the patients that has asthma, or only salbutamol? What do you have? Beclomethasone. All right. So this is really good. Here is a corticosteroid that we give, okay, which is used for asthma. It's called Advair. Seretide. So do you have this? Have you seen? So you know the best way of using this one? Do you want me to go through it?
the device itself.
The device. Yeah. So you just open it. Exactly.
Yes.
So you just
Perfect.
open it until you hear a click. And then you put your hands, small finger, on the lever. Did you hear that? So click and then click. What is inside is not inhalation, it's powder. Very tiny, minute powders that you need to really ask the patient to really make it very hard. So you ask him to put his mouth on the mouthpiece, this one, and again. And count to 10. So usually it is twice daily. The good thing about that is you ask your patient to use it even if they are okay. If they got prescribed that, this keeps them okay. As Kamal said, it reduces inflammation so they can breathe better.
This is the actual treatment.
So this is the actual treatment. So ask them to use it morning and evening, all the time, so that they're getting the right thing. So they will not use a lot of salbutamol that makes their heart go crazy. And then in order for it to close, you just press one time, you hear one click. So 2 clicks opening, 1 click going back.
This device is very good for patient who has, for example, arthritis. So they cannot push this one hard. So they can use this device. You don't have to push that much. So if patients are really old and have really severe arthritis, usually can do that. So if they use this kind of device, it will be easier. One more thing, when you do that, your dose is now ready. You cannot shake it. You cannot turn it like that, upside down. You have to be like that. If he do that, he will lose his dose. That's very important. And
They have a counter, yes.
it has a counter here. It shows how many doses left. Okay? One more thing, with any kind of inhaled steroid, what the patient has to do after he take the dose. Very important, to rinse the mouth with water and spit it. For what reason? Yes, great. Because it's a powder and it's really big particles, it stick in the teeth and it make the yeast infection. That's it.
Right on. So another kind of delivering oral corticosteroids is called turbohaler. Turbohalers, for example, this is budesonide. Budesonide is one of the inhaled corticosteroids. So turbohaler gets better amount of medication into the lung, and it's a little bit easier than doing the discus one, but it's way better than the inhalation. This one is with the Pulmicort. It has a small thing down here that you can revolve. So you go all the way and going back. So let's hear that again. God bless you. So you hear the click? So once the patient heard the click, he holds it like this, so 45 degrees, and again, put his mouth on the piece and
I think if you use 3 of them, you will, for sure you will lose the patient.
so it's the same thing actually. But the thing is, you have to hear the click. So do it all the way and then going back. Hear the click, put it in the mouth, inhale, and so the same thing. And you can actually also ask the patient to rinse the mouth with water just to prevent organisms, any steroid, any steroid that you need to give to the patient. You have to ask your patient that. Use it regularly and to give it with water. Go ahead.
One more thing, sorry. Both of them are powder, so don't ask the patient when he's taking breathe out away from the powder. Otherwise, it will be like moisture, right? The moisture will be inside the powder. So if he's breathing out, away from it. Number two, if you want to clean it with a dry, any kind of dry towel. Don't use water. He can use water here, but he can't use water. One more thing, this has a counter. But it's very important, the counter, it will not count after each one. So this is very confusing. It happened with me before I be a pharmacist in Canada. I was a pharmacist in Egypt, but I didn't know that. So if he used this one, it will not change after every time. It might be changed after 5. So that doesn't mean he didn't take his dose. Especially with the powder, he will not feel it. He will not feel it. You can't imagine. I used it by myself. So I look at the counter. Oh, it's still 60. I use one more time. It's still 60. That's what happened with me on the street. Oh my God, still 60. And it's like, it's like, okay, even if 60, I will not take anymore. So till then, it will not change after.
Right. So please have a look on these. Take it, come and try it yourself, and try to use it. Thanks a lot, guys, for your attention. Thanks a lot for the time that you've given us. We're really happy that you've given us this opportunity to be with you today. Please feel free to come and ask us for any questions, or come and see the turbo healers and discuss if you want to try it yourself and count to 10. So thanks again. We appreciate it.
Thank you so much.